epidemiology and advisor to the World Health Organization. Mary-Louise McLaws joins us now from Sydney. Great to have you on the programme. Welcome to you again. Mary-Louise, I remember speaking to you when we just had 1 million global cases. We're now at 30 million. Help us understand why it has jumped so much to this level in the past few months.
In Europe, they are having a very unpleasant conversation about learning to live with the virus. And I'd prefer the term trying to reduce the risk. Learning to live with the virus is as if they're throwing their hands up and assuming that public health measures are too difficult and that the community won't abide by them. So they're hearing many different rhetorics from many different political parties. So sometimes within countries, that polemic has stopped the average, person on the street from understanding what they should do. So leaders need to stop being political. We can't politicize this disease, and we really need to get the public health measures in place, because we are not going to get a vaccine in the next 6 months even. So there'll be a lot of people dying in between that time. And France has had an enormous upswing. They've got 56% of cases so far have occurred in this second wave. And in their first wave, they had 30,000 deaths. So they are going to have that or more soon. So I can only beg Europe to understand that public health measures are cheap and they're effective, but all the leaders need to come together, stop being political, and send out the right message that we can reduce the risk and can live with this, but with reduced risk.
And I like what you say. You want to beg Europe, but winter is coming to Europe now. What are your predictions for these winter months, even though they have such sophisticated healthcare systems across Europe?
Oh, they do, and it's very well funded as well. I can only hope that they start pushing vaccination for flu for the coming winter season, because we do not want to see a twin pandemic of influenza plus COVID-19. I'd also want to ask that Europe start focusing on their young. The young are our future, the 20 to 39-year-olds. Now, they are often underemployed. They often have to work several jobs over several different areas, which means that they get to meet lots of different people to have a risk of acquiring it and spreading it. But we need to ask the young to wear a mask and keep social distancing and get tested, because they do not want to go into middle age with potentially long COVID, those nasty symptoms that remain afterwards, chronic fatigue that's unpredictable, cardiovascular issues, respiratory, brain fog, all of those nasty side effects, and we don't know yet how long they'll last.
That really is a message that needs to get out there, Mary-Louise, especially having been in London myself, seeing it firsthand. Very few people wearing masks outside and even inside. I want to ask you about India. It's expected to surpass the US by the end of this month in case numbers. What goes through your mind when you think of their 1.6 billion population and these huge rural areas without hospitals?
If it's a reminder to the rest of the world, this should be it, that our disadvantaged, homeless, and those that live in crowded conditions are at huge risk, and we need to plan to help them, not just to test them, but we really need to improve their life, to improve survival across the planet. So if we can't do it right now, we need to plan for the next pandemic, that we need to bring all of the disadvantaged up to the middle class, so that they don't have to suffer this. But India has been using some very innovative methods. They do need to get out the verbal message, because literacy levels are not always high across all of the country, and they have enough person power to be able to do that. But it is an enormous challenge, and I think we're all holding our breath because we're very frightened at the potential for an acceleration across their continent.
Thank you so much, Mary-Louise McLaws, joining us there from Sydney. Really appreciate your time and your analysis as always.